Hey guys, welcome to Betrayal of the Body. Nikita here, and today we're going to talk about the complications that came up after my cancer battle, pretty much where I left off in my last video. So when I had this surgery to remove my fallopian tubes in January 2010, they told me when I woke up that they got all of the cancer and that part of my journey was over. And but they found something else, and my doctor told me that I had endometriosis. And so I went and did some research, and I'm like, wait, endometriosis is the lining from the uterus. I haven't had a uterus in over a year. How do I have endometriosis still? I mean, it says here in the interwebs that the cure for endometriosis is a hysterectomy, and we did that last year for my uterine cancer. So why do I still have endometriosis? Well, my doctor then comes to me and tells me that she wants me to take this chemo treatment that is going to force me through menopause, and it's going to cure the endometriosis. That it's going to, and the way that she expected this to work was that the menopause starves the endometriosis tissue, so it can't keep growing, it can't get any worse, and then the chemo was supposed to kill the endometriosis tissue while it was in its weakened state. I went through 7 months of chemotherapy, once monthly injections, to try and treat my endometriosis. So let's talk about chemo a little bit. What chemo felt like and what it was like. I personally was put on Zoladex, and that was the name of the chemo that I was on. And this particular chemo, it came with a 60% chance of hair loss. I mean, my doctor was really upfront with me about what to expect. She told me it was going to be hell, and it was. My side effects started immediately after the first injection, and what they did, it wasn't like a drip or anything like that. I picked up a shot from the pharmacy, and I would take it to my doctor, and they would inject my stomach in the fatty tissue of my stomach area, and this little pellet about the size of a Tic Tac. You could feel it. It would leave a little Tic Tac sized bruise. And it would slowly dissolve over the month, and then the next month they would put it in the opposite side of my stomach and alternate sides going through. I went through 7 months of a 9-month chemo treatment. We quit at 7 months, and we'll get into that. But after the very first injection and every injection after that, pretty much it was as miserable as you can imagine. I was so weak, I couldn't even get out of bed. I was throwing up into a trash can next to my bed. I was having accidents in my bed. I literally could not get up out of my bed. I was barely able to remain conscious most days. I would have friends that were checking in on me, and I was a single mom at the time. During these weeks, though, the first week of my chemo injection, I would usually have my kids scheduled to be with their dad because of how bad it was. Then second week is similar to what people describe as the flu, I would assume. It was just, it really kicked my ass, muscle aches, you know. I could get out of bed, I could go to the bathroom. The accidents didn't really happen at this point, but I still felt pretty miserable. Third week, I was starting to get my energy back, more like a common cold feeling at this point, you know. Still kind of weak, still feeling kind of nauseous, still not feeling great, but able to function. And then the fourth week was what I called my power week, and I felt great, and I would catch up on everything that got neglected over the last 3 weeks and prepare for the next 3 weeks to come. And that was time for a new injection, and it would start all over again. And that's how my life was for 7 months. So with a 60% chance of hair loss with this medication, I did not ever lose my hair, thankfully. I had hair down to my butt, and it was a big fear of mine. I was losing hair by the fistfuls, but I never got any obvious bald spots, and I never lost it completely. So I did get lucky in that aspect. During this time, I was diagnosed with irritable bowel syndrome. I developed ulcers. I started having heartburn daily. After the surgery in January 2010, when they discovered the endometriosis and removed the fallopian tubes, I was still having significant abdominal pain, and I demanded they look further. Because last time I demanded they look further, we found a tumor. So I wasn't accepting that this is a fluke either, or that this was some coincidence or anything. So I demanded they look further. And sure enough, we discovered that there had been a complication in one of the surgeries. They're not sure if it happened when they removed my fallopian tubes, or if it happened when they tried to remove endometriosis tissue, or if it happened when they did the hysterectomy. They have no idea, but one of the times they lacerated my ureter. Now, that's just a fancy way of saying they cut the tube that connects my kidney to my bladder. Cut it straight through. And now, I don't know if this is EDS related or not, but what happened was that my ureter sealed itself shut with scar tissue, preventing my left kidney from draining. This went undetected for too long. By the time we discovered that this had happened, they scheduled surgery. Medi-Cal once again dragged their feet on approving that surgery. It took 3 months. Not 24 hours prior to my surgery date, my kidney ruptured. I was cleaning my house, preparing for my surgery, knowing that I would be down for a week or so in pain and that I wouldn't be able to do anything, and this was a power week for me, so I was cleaning my house. I remember I was crushing cans in my backyard, getting the recyclables ready, and I walked through my sliding glass door and I felt and heard a pop. And I was instantly engulfed in pain. I didn't even know where the pain was coming from. I was in so much pain. I was instantly drenched in sweat and in a lump on the floor. I crawled to the bathroom screaming for help. I stripped off all my clothes because I was drenched in sweat, and I don't fully know what my thought process was there, but it seemed like a good idea, and I was laying on the tile in my bathroom just screaming for someone to come help me. Blacking out, going in and out of consciousness. Thankfully, my roommate had a guest spend the night, and he heard my screams and called 911. I was taken to my local emergency room, not the place where I was scheduled to have surgery, and they said that I had a kidney stone and sent me home and said to follow through with my surgery the next day. So I did get to surgery, and I told them, you know, what had happened the day before. At this point, still have no idea that my kidney had ruptured. Told them that, you know, I had experienced the worst pain I'd ever felt in my life. I was taken to the emergency room. They gave me a lot of Dilaudid to stabilize me and to pull me out of shock, and then they sent me home with instructions for a kidney stone and said to come to surgery. And the pre-op nurse assured me that I was in good hands and not to worry, and that they'll get everything fixed up, ready to go. And so I went to sleep. I woke up twice before I was supposed to. And they had to put me back to sleep while I was still in the operating room. That seemed very odd at the time. When I woke up, I realized why this happened. So I finally wake up in a room, and my mom and my sister are there, sitting at the foot of my bed, and my mom tells me, don't freak out. Okay. People, don't do that. Don't ever do that. I don't care if they unexpectedly had both of their legs chopped off. Don't ever say the moment someone wakes up from surgery, don't freak out. Okay? Because you pretty much just told them to freak out. So with the timing that I swear never happens in real life, but it did to me, my doctor walks through the door before I even have a chance to fully freak out. And he tells me that my kidney ruptured, and that he tried everything he could to get through my blocked ureter, but he was unable to. And so they had to put a nephrostomy bag in me. And I'm like, bag? Bag? What do you mean bag? Where's this bag? And I start looking around, obviously, like to find this bag. And sure enough, there's this bag coming directly out of my back. Nephrostomy, meaning your kidney. Went straight into my kidney and emptied out into this bag. And then he tells me, I can't help you any further. I don't know what else to do. Your condition has elevated beyond my expertise. I wish you good luck. That's it. No post-op appointment, no referral, no clue what I'm supposed to do next, other than I have this bag coming out of me and they're sorry. Yeah, that was great. I went back to the specialist who was handling my cancer and told her what had happened, and told her that she had to find me somebody, you know, that she was the one that had sent me to this guy who didn't fix it in time, and now you got to find someone that can fix what he didn't fix in time, because I can't go the rest of my life with this bag coming out of me. And so she made some calls. It took a couple months. This did not happen quickly. Made some calls and found me the leading urogynecologist in his field, and he was able to help me. I met with him a few times, and then we went through with the surgery, and what he did was he did reconstructive surgery to my bladder and my kidney, and he placed an artificial ureter, similar to like an IV tubing, between my kidney and my bladder. And now this all worked out pretty fine. My kidney, they saved my kidney. They took the bag out. My scars aren't even that bad. We're all good to go there. I have since regained 100% full kidney function, which they said was impossible. That would never happen, but it has. And so I am very thankful for that. The only, I guess, permanent negative side effects from this particular problem is that now I no longer have any feeling down there when it comes to urinating. It's kind of just numb. I don't know when I have a urinary tract infection, which is doubly dangerous because now my bladder no longer has, in simple terms, a one-way valve. Before, naturally, when your ureter empties into your bladder, it didn't allow the urine in your bladder to then go back up the ureter and into your kidney. Now, if it's all functioning properly, naturally, it doesn't let that happen. But now, because it's this artificial open tube, if my bladder fills up, the urine goes up that tube and into my kidney. And so if I have an undetected urinary tract infection, it becomes a kidney infection in the blink of an eye. And that is really the only feeling I get when I have to go to the bathroom, is my trigger. Instead of that, ooh, gotta go, feeling that most people get, is I get this sharp pain when the urine refluxes up my ureter, and that's my signal. Oh, gotta go. My bladder's full. But other than that, that all got resolved in July 2010. My kidney ruptured in May 2010, and or what am I saying? July 2010. That's when the seizures happened. I'm sorry, I'm getting my dates mixed up. May 2010 is when the kidney ruptured, and then in October, the end of October 2010 is when we were able to fix it and get the nephrostomy bag out. And since I brought up those seizures, we will mention those briefly, but there will be a video talking about those more in depth. In July 2010, I began having seizures that to this day they've been unable to diagnose or treat, and they've only gotten worse over the years. So guys, if you like what you're seeing and you want to learn more about me and learn more about these disorders, please stay tuned. My next episode will be talking about my seizures more in detail. Please like, share, comment, subscribe. Hit that little bell if you want a notification when I post my next video. And ask me some questions. What do you want to know about? Everything I've talked about so far. If there's anything that you want to know some more details about, feel free to ask. I'll either make a video about it or I'll just tell you. So, yeah, talk to you guys later.